All right, hello everyone. Today, my name is Eduardo. I'm going to be interviewing a healthcare professional. I'm gonna let her introduce herself.
Hi, I'm Jalissa. I'm a registered nurse. I've been a nurse for almost a year now, and currently I'm working in St. Luke's. Currently I work in the inpatient rehab side. So we do 3 hours of intensive therapy a day, and us nurses help our patients hopefully go back home and be able to do their daily activities of living. And yeah, I think that's what I got for now.
Yeah, okay. So I'm just going to give you some questions and let's see if you're able to respond to them.
Okay.
So the first question, what were the education and training of the professional you interviewed?
Well, I guess me.
Yeah.
So I did go to school at CSI, and the actual program is 2 years, so 4 semesters. But before that, I did my prerequisites, and basically that took another 2 years. It could have been a little bit less, but I did want to graduate with my Associates of Health Science. So I took an extra semester, and that really helped. I also did take some summer classes, so I can't remember in total how many semesters it was, but I know it was 2 years before the nursing program and then 2 years during the nursing program, so in total 4 years.
What year did you start college?
I started college the year of COVID, so in 2020, where we still had to wear face masks to attend class. So.
And what year did you start your nursing program?
2022. I graduated with my Associates of Health Science in May, and then in August of 2022, I started the nursing program, and I graduated the nursing program in May of 2024.
Are you continuing education as an RN?
Yeah, so since CSI is only an associate's, I do want to go for my bachelor's. I'm currently in the RN to BSN program at Lewis and Clark State College, and I'm hoping to get my bachelor's by May of 2026.
So, next year?
Yeah.
Okay. What is your work environment like?
Well, I do work in a pretty big hospital in St. Luke's, but the actual unit that I work in is the inpatient rehab, and that itself is not big compared to the other units. Our unit holds only 14 beds, and it's kind of like on the outside of the hospital, so it's like very hidden. But other than that, it really varies. Sometimes it's a fast-paced job, sometimes it's very slow, and sometimes there's not enough patients where you do get put on call. It kind of varies. It's not like it comes with seasons or anything. Let me think. I guess during summers it can get a little bit more busy because we see a lot of like motorcycle accidents, a lot more just car accidents or falls because people are just outside doing stuff. And when we get a lot of strokes, that's just a lot of more acuity to us, so that just that makes us a lot more busier. When we have a lot of strokes, or our schedule's a lot more busier than other days. So
what about the winter season where there's ice?
We do see some specifically with cars. We also see a lot of hip or neck fractures from like old people falling. Let me think. I feel like we see more, I want to say like older people during the winter time, and then like during summer it just varies because there's different kinds of accidents of different ages. So it still can be very busy. I think November was our busiest month, I cannot lie. And then during the springtime it started to slow down again, but it really just depends.
Okay.
It really depends.
So you worked in rehab, correct?
Mm-hmm.
What's the largest like unit in St. Luke's?
In St. Luke specifically, I want to say it's either the cardiopulmonary floor. I don't know how many beds it fits, but I think it's like on the 20 or 30 beds, and there's a lot more nurses there. It's a lot more fast paced. I'm not able to train there just yet. I do float sometimes on the medical unit when there's not enough patients on my floor, and it's a lot more fast paced than what it is in rehab, solely because you get more patients there. I think usually in rehab we'll get from 2 to 4 patients per nurse, while on the medical floor you're automatically started with 5. So it gets a lot more busier during the medical floor, but you have a lot more help in the medical floor. You have like a resource nurse and the charge nurse, while in the inpatient rehab you don't have any of that help. You do have a charge nurse, but the charge nurse itself does take patients, while on the medical floor they don't. They're just there to help and help make things run more fluidly.
So you said something about like you do floats, correct?
Yeah.
So like with the floats, you go to different units.
Yes.
Is it like, how to say this? Are the same like things you do in rehab the same as other units?
Yes and no. So our care of nursing is still basically the same. Like we still do medications or IV fluids or any kind of nursing things that a nurse can do, we can still do in the inpatient rehab. I think the huge difference is that, like, let's just say on the medical floor, they're always in hospital gowns. They're not really encouraged to move, and also they don't have set meal times. While over there, our goal is for them to go home, so we actually do let them use normal clothes so they can get into the habit of putting their normal clothes and brushing their teeth in the very morning. And we do have set times for meals, and we do help with passing out trays and everything. So I think the inpatient rehab is just more scheduled based and more quote unquote closer to home, because our goal for them is to be able to do the exact same things they did on rehab home individually. So I think at the hospitals, let's just say for example, if we need to shower a patient, we do it ourselves on the medical floor, but in the inpatient rehab we encourage them and we guide them through showers and how to do it and how to dress, because when they go home they won't be able to do that by themselves. So
all right, can you tell me about the staff and coworkers?
Yeah, so we have a little bit less than the actual medical floor. So sometimes you'll be stuck with just 2 nurses on the unit. Sometimes there's only 1. Sometimes there's 4, depending on how many patients we have there. So we work as a team, I want to say. We help each other just because the charge nurse also gets patients, so they'll help me out, and if I need help in something, they'll help me out. So we do work a lot with therapists. That's our biggest thing, is that we do a lot of communication with a lot of physical therapists, speech therapists, and occupational therapists, to let us know kind of how our patients are doing and what specifically they want us to help the patients with. So if there's like a change in status or they're able to do something, they're going to tell us to encourage the patient to do it by themselves. Or like if it's a speech therapist and the patient is finally able to eat better, they're going to tell us to change their diet and specifically how they're going to basically swallow their food and all that. So we also are very close to the providers. We do a lot of communication to our doctors. We only have 2 doctors on the unit, and if they're not in the unit themselves, they're always on call, so they're always just a call away. So
yeah. How's your schedule like?
So I work 3 shifts a week for 12 hours, so in total of 36 hours a week.
So you're full-time?
Full-time, yes, I am full-time. I think part-time is only 2 days a week. And it depends. That's kind of like the sucky part about nursing. If you're working hospitals, is that you don't really have like a set schedule. Like you can be working weekends, you can be working a Monday, you can be working a Thursday. Every week changes. And I think it specifically goes that every other week you're supposed to work. So every other weekend you're supposed to work. So one weekend I won't work and the other weekend I will. So it just depends. I feel like you don't have a set schedule with nursing at hospitals. So
what are the main stressors?
I think the main stressors is honestly keeping your patients safe, because your patients can get really sick or really get ill very quickly, and when you see the signs you have to recognize them quickly. Like let's just say for a patient who's going septic, really time is the key to a better recovery. You want to catch it as soon as possible. If not, their chances of them surviving sepsis is lower the more time you just lay it off. And I think the unit itself can be fast-paced. So if you have a lot of high acuity patients, and let's just say both of your patients are requiring a lot of care at the same time, that really does stress me out, because I want to make sure both of my patients are safe, but I can only be in one room at the same time. So sometimes I will go home with just like my feet hurting, really tired, because all day I've just been nonstop. So I think that's my main things.
How many people are in the unit?
Like workers?
Patients.
Or patients. It really depends. There's no real set number. So you can have from 0 patients, because there has been times where we had no patients on the unit, and then literally 2 weeks later you can have 14 patients, like all beds full. So we can have 1 through 14 patients.
How many staff?
Staffing, it really depends, because there's so many people that actually work in the rehab unit. Nurses themselves, I think like we have 8 specifically on our unit, and then we have a bunch of physical therapists, and then we have also like the case management, and then the admissions coordinator and the nurse leader, the nurse assistant manager. There's honestly a lot of staff for how small of a unit there is. So with the patients, they're getting multiple staff members in on one day. They probably see like 7 different kinds of staff members, just because it could be therapists, it could be doctors, it could be nurses, it could be case management. So yeah.
Okay, next question. From your point of view, what are the rewards of this profession, and what do you think they are?
So I think the biggest reward is, of course, helping people. I think that's the biggest reward. It's just like at the end of the day, if it was a crappy shift or something, you still help people and you still try to make people's days and help them hopefully get better. I think also a reward, even though our schedules are kind of all over the place, it is very nice to have 4 days off instead of just 2 days off if you work like a regular 9-to-5 job. I think also the nice thing about it, if I'm being very honest, is just the financial stability it gives you. Even though sometimes you are put on call, I feel like I'm more financially comfortable than what I was as a CNA. So I think those are the bigger rewards. So,
what are some benefits you earn from nursing?
The benefits itself from the hospital, like of course you get like good insurance, you get actually that's kind of it from the actual hospital. Yeah. Of course there's always like discount codes they'll give you because you're a nurse or anything, but honestly the biggest rewards for me, or the biggest advantages to work, I guess, is just working only 3 days a week and actually being able to help people. So it's not for everyone. It's not a job meant for everyone.
Any other insights or interesting things you learn about this profession?
Honestly, you're always learning as a nurse. You're always learning. You never stop learning. You're always seeing something new. Even I've seen nurses who have been on my unit for, let's just say, 26 years. They constantly have questions and they're always asking either providers or trying to make their own research, of course, with like hospital related websites, right? Because you never stop. There's always something new to learn, and with patients there's always different kinds of diseases and disabilities. So it honestly continues to interest me, like how many different kinds of conditions there can be, because you'll never have the same patients over and over and over again. There's always something new with them. So
okay, this is going to be a random question, but veterans having PTSD from traumatic events, right? Are you having like some sort of traumatic event you've seen at the hospital?
You definitely can. When, let's just say, when I worked on the medical floor and you have to be taking care of patients who are on comfort care, so basically they're gonna pass away. It can be very traumatic to see like the sadness with their family members around. Also for me, like a traumatic experience is, let's just say, for a dementia patient I had, where he tried to choke me. I do get like not PTSD, right? But I definitely do keep my distance whenever I do see someone that has either behaviors or has dementia. Like, I don't get too comfortable with patients because I do get scared that I might get into that situation again. other than that, I think you do get immune to it, as bad as it sounds, but a lot of this stuff does happen very often. There's a lot of people who are aggressive, and there's a lot of people who pass away. So I think if you're crying or if it's taking a toll on you, it's definitely best to find a different kind of path. It doesn't mean you have to quit nursing, but maybe you do need to go to the clinics, because work should not be taking that huge of a toll on you. So
how much time do you spend on paperwork?
Paperwork, a lot.
A lot.
A lot. Especially on rehab, we do a lot of charting. I think honestly the most annoying thing of my job is probably charting.
Yeah.
I don't mind taking care of people. Actually, I would prefer to just constantly help my patients instead of just sitting down and doing paperwork. But it has to be done. So.
For how much time?
It really depends. It could take quite a bit of time, especially with your care plans and your education and your actual shift assessment charting, and then if you need to do a provider's communication. It all varies. Sometimes I only spend, let's just say, 30 minutes per patient, while sometimes it just seems like I'm just on the computer for a good hour just trying to finish everything that I have done.
So do you take care of your patients first and then chart?
Yes. You definitely take care of your patients first, and then you do whatever paperwork you've done. Even if it seems like you don't have the time, we just stay after we finish doing all of our work, and then we chart, because our patient's care comes first.
Yeah.
So.
Okay, so last question. How is your experience on thoughts and feelings as a nurse?
Well, this past year that I've been here, it's been good. It's been there's been a lot of learning. There's been a lot of it seems like downhills, right? Because you're still learning as a nurse. There's a lot of uphills too. I think just the most thing is losing the fear, and being very confident in the care that you give. I think that's what I've learned the most. And I think one of the things that has helped me is just knowing that there'll be days where you're going to be slow, and there's going to be days where you feel like you don't finish everything. So it's been great. I love my job. I'm ready to just grow as a nurse.
Okay. And my thoughts as interviewing you is being a nurse sounds difficult, but at the same time it sounds rewarding.
Mm-hmm. Yeah, I definitely would say so. Mm-hmm.
All right, Jalissa, well, thank you for your time and presence. And